Government has released funds for the completion of the Afari Military Hospital in the Ashanti region after the project stalled due to financial constraints. Completion date for the 500-bed capacity hospital has repeatedly been shifted after construction began decades ago. Project contractors Eurojet Invest are optimistic of completing the facility by end of the first quarter of 2024.
The 500-bed capacity Afari Military Hospital has 50 medical and non-medical buildings with 15 operating theaters. It has 9 delivery rooms with 2 endoscopy operating rooms. The hospital will also have a medical gas plant for production of 5 medical gases. All buildings are already completed with some furniture installed, awaiting medical equipment. Financing for the hospital project stalled, resulting in the long halt of work on the facility that was at an advanced stage of completion. Presidential Advisor on Health, Dr. Nsiah Asare, reviews the necessary funds have been released for the project to progress.
No contractor will come to site if he doesn't have liquidity. Especially if he sees that if you are not take care to be paid. They've received liquidity, but they have to. We continue giving them the money through the Ministry of Finance for them to the flow of the liquid. If it flows very fast, then things will be very fast. But what we have seen here today, we also will brief Ministry of Finance. And I'm sure Ministry of Defense came here. I saw some story that they were here last Friday also. And the engineers you need to come, and I'm sure they will also come again in their team, and then they will send a report that at least the liquidity you are talking about, the fuel that is sent to them, is being put into good use. And the EDI, Eurojet, wants to finish this as quickly as possible.
At the time of the visit, some staff of Eurojet, the Invest contractors, were on site clearing weeds that had overtaken the buildings. Dust that have engulfed some furniture were being cleaned in wait for engineering staff and other workers. Most medical equipment are under lock and key at the site, with very delicate ones being stored at the warehouse. Dr. Nsiah Asare dispels rumors the equipment is exposed to extreme weather conditions.
My MRI uses helium. It's a magnet which turns around. Nobody will put MRI in non-air conditioned room. So let's get it straight. So whoever talks about MRI sitting in the sun, CT scan sitting in the sun, CT scan is a radiation material. If you put it outside, somebody even comes to sit on it. If you are a man or you are, testicles will go, or the gonads, and then there will be nothing produced again. So nobody will allow such things to be sitting, equipment to be sitting in the sun. So it's not true.
Meanwhile, Eurojet the Invest has expressed commitment to completing the project. Ahmed Abu Shama, main site manager.
Zogfos, when you're back to site, you can't back with full capacity in the same one night. You have to take some time to bring your skills laborers to come back and back work. And we have our laborers already. So we already started. And nowadays we have not less than 150, around 200 persons per day. And we expect within 2 weeks, we come back more than 400, 500. And the beginning of after Christmas, we can reach more than 1,000. This is our expectation for the manpower to back to site. This is to be enabled to finish the project as recorded time.
The Afari Military Hospital is one of 9 health projects under Eurojet the Invest. Some of the projects in the Ashanti region are yet to be completed, though it commenced decades ago. For JoyNews, Nsiah Asare, Kumasi.